Welcome to the Provider Portal, a web-accessible database that includes claims data for all North Carolina Medicaid patients. The portal is for Community Care of North Carolina, also known as CCNC, providers and their partners to provide information that will improve the efficiency and quality of care for our patients. Partners of CCNC primary care providers include local mental health entities, health departments, hospital providers, and other care providers who have system access agreements with CCNC for the use of Portal. I want to show you how the Provider Portal looks to providers, as well as how we use it by going through a few scenarios. I work as a family physician in a rural clinic, but these scenarios are all fictional. However, they are based at least in part on real folks I've known. So in the first scenario, I'm in my office seeing little Johnny Doe, who's fairly new to my practice, so I don't have much historical data on him in my chart. He is here because on a dare he has stuck peas in his ears and no one at home had been able to get them out. With my alligator forceps, I was able to get them out in just a few seconds, and I find myself with a few minutes to spare with Johnny and his mom. So I look him up in Provider Portal. I see the name of his old PCP here in case I need any immunization records or any other records. And I look into his visit history to find out if there are any gaps in care that I need to address today. I look to see what other kinds of care he's had, and I find that little Johnny has some problems with putting some things where they don't belong, foreign body in ear, foreign body in his gastrointestinal tract, and I find that actually he's due for a well child visit. So today I'm able to do that for him. I had a cancellation. I know Johnny's family has trouble getting to my office, and I'm able to save them some time, some money, and we get him the care that he needs in a timely manner. In this second scenario, I'm seeing a 53-year-old whose recent routine labs show her to be newly in kidney failure for no reason I can tell from my office notes. When she comes in, I ask her about her other medicines, and she says that she only takes what's prescribed from here, nothing over the counter, and so I'm left wondering whether I need to start doing a referral to the kidney doctor, some more labs, some imaging, something, because something new is obviously going on. I know that in the recent past we've tried multiple different anti-inflammatories, but she insists that she has not been taking multiple anti-inflammatories at a time. I can go into Provider Portal and see what she has actually filled. I can do a sort by the types of medications that she has picked up. This shows me what she actually probably has in her home. She has other pain medicines because she's not controlled on just the anti-inflammatories, and I find that indeed she has been taking 3 different anti-inflammatories at the same time, which can definitely be damaging to her kidneys. So, mystery solved here. No more healthcare dollars spent to find the answer to that question. Turns out I need to do better patient education and definitely insist on having all of her medications at every visit. Now I can go forward addressing her acute renal failure here in my office. This is about the only way I can get the information about what a patient actually has at home, unless they really do bring every single medication with them to their office visit, which they usually don't. In my next scenario, I'm working in a hospital emergency department with a patient with abdominal pain whose boyfriend mentions that she's just recently been to another hospital near his home and had, quote, something surgical done there. He and she tell me they don't know exactly what was done, and I'm concerned based on the amount and position of pain she seems to be having that she might have a complication from that surgery, though the scars on her belly don't appear to be as recent as she is describing. I find nothing on my exam of her other than apparent exquisite pain when I touch anywhere near her belly and the old surgical scars, so I go to my desktop computer to order some blood tests and pain medicines for her and a CT scan of her belly to see if I need to call our surgeon. While I'm at my computer, I log into Provider Portal and go to the Visit History tab to see if I can find out what was done at that other hospital. I find that this patient was in another ED just last week. This is the middle of December now. And I find that she has had 218 ED visits in the past 15 months. I scroll down because my question originally was about whether she'd been in a hospital for surgery, and all I'm seeing is ED visits and imaging. Office visit, I find that she has been to a family practitioner once this year for a headache, but generally seems to seek care in emergency departments. And I'm noticing that she's had so many CT scans that I'm concerned about her radiation exposure, as well as a behavioral pattern that might indicate an addiction. When I go back in the room, she looks calmer, so I take this opportunity to confront her about these findings in what appears to be various emergency departments. If we were in the true Provider Portal, you would see the actual provider names. The phone numbers would be correct, and the provider names would be ones that you would recognize. So I tell her that I'm concerned about the pattern of behavior I'm seeing. I offer to set her up with an addictions counselor, and she nods to me. I go back to my desktop, call our social worker on the phone, go into the portal to find out the phone number of this patient's local mental health entity based on her county of residence, and get that phone number. Should be able to get that right here, as well as other providers that she has seen for her problems. When I return to her bedside, she and her boyfriend are gone. Now, if the case had gone another way and this patient had seemed more in need of medical care for her belly or head, I could go to the Visit History tab, hover over this provider name, and get the information I need to get the results of the scans she had had to see if I need another one today. With our intervention today, courtesy of Provider Portal, we've just saved the patient from being exposed to extra radiation, made what might be the first offer that she's had of substance abuse help, saved my emergency department team from having to do an unnecessary workup, and saved some Medicaid dollars from being spent unnecessarily. So you see that the Provider Portal can help medical providers to deliver the right care at the right time for our patients. We hope this system will be a model for other states and feel proud, lucky, and thankful to have it. Thanks.